don't just accept the standard of care that's been there for a very long time, where you go to your primary care doctor, they give you your blood test, and they say, I think you're fine. Everything looks pretty good. And you don't feel well. You still are fatigued. You don't have the stamina to do what you used to do. You're not sleeping well. You have mood swings. So many different symptoms that can happen. And so we're now in a time when you really can take your health, and should take your health, into your own hands. So who can you and should you believe? I believe in your primary care doctor. I believe in your internist. Absolutely. They've been carrying you for years, I hope. But you want to make sure that when you do pursue these avenues, there's a lot out there. You have to be careful, and you want to make sure that you are seeking out care that is going to be supervised by a physician, as it is on this panel. We are all board certified physicians in our given fields. And you want to make sure that they're supervising the care and that they have good background, but also, if you are going to be given product, that you're given something that is safe and has stood the test of time. And that's what you're going to get with Biote. So what are these hormones anyway? What are we talking about? They're chemicals. They're just chemicals. This is the chemical structure here. Most of the hormones we're going to be talking about tonight are actually built off of the chemical cholesterol, which you're familiar with, but it has so many different variants. And they are your sex hormones. You have certain hormones that are sort of your short-term sugar in the form of cortisol. And then, of course, thyroid. You're familiar with these names. And what is this? It's a chemical messenger that then goes to a target. So you have, for example, a thyroid hormone, and it's made by the thyroid gland. You have estrogen hormone made by the ovaries, and you have testosterone, which is a male hormone, also produced by women, and in the men it is produced by the testicle, and it has targets. So these are going to have a receptor in different areas that account for why you will feel well, or if you have a deficit of these hormones, you will not feel well. And they work in a lock and key fashion. That's how receptors work. So it's very interesting. Some of the problem may be that you do have a good level, but your receptors are blocked by something else, or you have a deficiency in receptors. It's all kind of interesting, but it deserves a little bit more of an in-depth look than just hand you your piece of paper, say, hey, look, your hormones are fine, I can't help you. No. Let's dig a little deeper and find out why, if these numbers are good, why are they not effecting the change that you want? So here is a list, and it's an important list. And I could breeze through it and just say, look at all the things associated with a lack of hormones. I want to emphasize also, this is a list you could use as a classic menopausal symptoms, menopause being the cessation of your menstrual flow in women, but also andropause. In other words, when men go through their changes, so-called, where they do not have robust levels of hormone, they too can go through a lot of experience these symptoms. So extreme fatigue at 3 to 4 p.m. Many of us will kind of hit a wall, but you need to be your own internal monitor and say, well, wait a minute, I did, but not to this extreme. I can't even pick my head up. Mood swings, my goodness, how often do we hear that? The women will come in and say, oh, my goodness, I feel terrible. I'm screaming at my spouse or my children, and then the next minute I feel better, maybe not elated, but better. And it bothers them that they're being so chirping and being so difficult with their family. Anxiety, they feel a constant sense of anxiety. They're not even sure what it is, that sort of free-floating anxiety, walking around sort of feeling tense. Tension and irritability, just not a happy camper. The lack of sleep is extremely important, and we talk about that a lot in our practice. Just the lack of sleep is extremely important in the sense that our older folks, as they get older, just even getting up at night and walking around at 3 o'clock in the morning is just not healthy. And depending on your level of health in terms of your strength, that can actually be risky. So lack of sleep will affect your daytime performance. That's not good. We don't need people falling asleep at the wheel when they're commuting home, or God forbid, when they have children in the car and they're driving them around. So this lack of sleep can have very, very dire consequences. Memory loss. This is a big one, big, big, big. And every one of us, I don't care how old you are, really, we have to be attentive to anything that could potentially affect our cognition. And there are more and more prescription medications. Most supplements are geared toward improved memory, but this is extremely important. And any of you who have been touched by the tragedy of Alzheimer's disease or have lost a loved one to dementia know how devastating this can be. So we want to stay sharp. And if there is something that can help us maintain our mental acuity, it's critical. Feeling of depression. This is so tough. And it's one of those things, perhaps a loved one at home will just say, hey, listen, you're so down, you sometimes need another party to wake you up to it. And you realize, my goodness, I am, right? I'm just not up for the things I used to be. I'm kind of mopey. I'm tending to be more secluded. I don't want to go out to anything that's social, et cetera, et cetera. Lack of focus. Mental acuity is a big one, and this is one of the ones that the men notice often when they do replace their testosterone to a better level. They realize they get a much better. They're sharper. They just find that they have better mental acuity, and it's noticeable. They really feel much better. And the opposite, of course, on the next column is brain fog, and women talk about it all the time, just brain fog. And before you worry that you're losing your mind, I do often say to my patients, mostly to reassure them because they're frightened that they're losing their minds, where I'll say, listen, just for 1 second, also women are very prone to multitasking and doing 10 things at once. And I always say, well, wait a second, you must concentrate on your given task as you're doing it. If you're putting the keys down, you've got to be mindful that you put them on the kitchen counter before you lose your mind because you lost your keys. We are often distracted by a lot of other things. So brain fog is that feeling that many women know, where they just don't feel that mental acuity. And that's an upsetting symptom. Hot flashes. I didn't change the slide, but it's okay. It's okay that you did. Just maybe go back. Hot flashes, very important, and those can be very distressing, a little bit embarrassing if you're in a work situation, you're speaking to somebody, you're in a social situation, just to suddenly have a hot flash and sweat in front of someone is, but it's also just upsetting. You can really, women soak their clothing and things like that. Weight gain is a big one. We get that complaint all the time on the men's side and the women's side. And I say to the men whom I treat for low T, and the women, the men might say something like, I work out like a maniac. I'm really a dedicated gym goer. I'm just not getting the results I used to get. And they're not unrealistic. They are actually adhering to a fairly clean diet and working out in a responsible fashion and just not seeing it. They seem to maintain the fat. And in women, it's that classic sort of mid-weight gain right around the middle. And they say, what is this? I really promise you I'm not overeating. And yet it's all sort of concentrating in the waistline. Joint pain is a big one, and that too is obviously can be very upsetting and distressing. Bladder symptoms, we see this all the time with menopausal changes. There's something called GSM, the genitourinary syndrome of menopause, where menopausal symptoms result in bladder symptoms, including leakage of urine, frequent urination, along with painful sexual intercourse. Headaches, you saw that in the picture of the woman who looked unhappy. There she is holding her head. So headaches are also common. And then the decreased sex drive and or performance on both sides. We see this in the men and the women. So happy to be partnered with Biote. They are taking all of this into account. What are the hormones that can be manipulated or corrected? Testosterone, estrogen, and thyroid are the basic main hormones that we address. The Biote method also incorporates nutraceuticals. So these are nutritional supplements that will work in concert with the hormone replacement and optimize hormone replacement. And it's just that circle, that wonderful circle that you see there, where we would start, for example, with some lab testing and a good history. We can plug that into this remarkable clinical software, and it will then devise for us a program that would make sense for your particular needs and your deficits. And then we measure the different hormones we need to measure for your problem, whether it's progesterone, thyroid, estrogen levels, testosterone levels. come up with a program specifically for you, add nutritional support if we need to, and then we work with a very, very reputable and certified pharmacy that provides our pellets, to provide something that is really geared towards you, very individualized and flexible, so that we can modify if we need to, if there are some areas that where you are not achieving your goals.
So just to begin, as far as menopause, menopause is defined as going 12 months without a period. And until you reach that threshold, you're not technically in menopause, which is all fine and well. But for women who are in those several years leading up to that time, it's not satisfactory because, as you mentioned, they're going to their doctor, they're getting blood work done that says everything's normal, you're fine. So that's sort of where we come in. But regarding menopause specifically, about, as you see, 6,000 women a day, up to 2 million women per year will enter menopause. And symptoms may begin up to 15 years earlier. But what I will say is the average age of menopause in our country is 51. And I would say most patients that I'm seeing with these issues are having symptoms at least 5 years earlier, maybe not quite 10 to 15, but certainly it's very common to see symptoms 5 years earlier. And most women are also affected in more ways than they realize. A lot of times women think of menopause as just hot flashes. And that's definitely relatable, but it's certainly not the only symptom that we see and experience and help women with. And the other thing is menopause is not an endpoint where if you go through this period of time, you go 12 months without a period, suddenly your symptoms start to dissipate or go away. It's typically not that way at all. As probably most of you know, the number one cause of death for women is heart disease. It's not breast cancer. It's not any other type of GYN cancer. It is definitely heart disease and has been for many generations. But we know that before menopause, premenopausal women, the risk of heart disease is 1 in 7 women. Suddenly after menopause, that number rises dramatically to 1 in 3 women. So it's something really to note and to think about giving protection for. So estrogen is a hormone produced in the ovary. It is present in both men and women. It can be produced by fatty tissue as well for women and men, and also produced by the adrenal glands, which both men and women have. However, it's predominantly thought of as a female hormone, similar to testosterone being thought of as a male hormone. The main things that we think about as far as symptoms and signs of menopause being treated by estrogen are hot flashes are dramatically controlled by estrogen therapy, really better than any other option that we have for treating hot flashes. Also helping with maintaining bone density. We know that bone density and bone mass declines significantly in perimenopause and beyond into menopause. So again, replacing some of that estrogen can help significantly with that. It also can help with collagen in your skin, so can improve having like less wrinkles, less skin loosening. And that's something that obviously a lot of women are happy to see. When we replace estrogen, we do find that there's a much improvement in hot flashes. The collagen in the skin is increased. Bone density has helped. Bone strength is also increased in addition to bone density. So that's important. In addition to doing weight-bearing exercise, estrogen is sort of like giving you fuel in the gas tank to work with the weight-bearing exercise that you may do. Also, estrogen, we know, helps maintain memory and perhaps improve some neurodegenerative diseases and conditions. And we also know that it does lower cholesterol and increases HDL, which is thought of as the more healthy cholesterol.
Okay, so this is a very busy slide, but I think it's really important. Why does the delivery method matter? And I think the answer is it matters a lot. There's really 4 ways that we prescribe hormones to our patients. And as we're going to be able to see through this slide that the subcutaneous method, like the pellet, is really the most successful and safe. So the first way we give hormones or oral, and there's a first pass effect. And what that means is that there's biotransformation before it enters the systemic circulation, and it lessens the bioavailability of the hormones. And everyone, it's different for everybody. And that happens a lot in the liver and the small intestine. There's also some people get a lot of GI upset or nausea. With oral, it has to be administered every day. There's some liver toxicity. That's why we monitor the liver enzymes when we give it orally. Testosterone is not effective orally. So that's not given orally. It's usually, it could be uh, estrogen or progesterone. We could do sublingual, but that's very short acting, and that usually has to be given 3 times a day, which is, for some people, that's just not something that they want to do and easy to do. There's also injectable. There's biweekly, weekly injections of testosterone, and I see this a lot. It's a roller coaster effect. There's like a big jump in testosterone, and there's like a dumping effect afterwards. And a lot of men, they feel it a lot, and before they get their next shot, they get kind of cranky, and also they start taking their shots a little too close together. I've seen that as well. There's pain with injections. There's higher levels of red blood cells and aromatization. Aromatization means that the testosterone is transferred to estrogen. And with some men, we even have to give them some medication once a week to lower their estrogen with the injection therapy. It also can increase platelet stickiness. The third delivery method is transdermal. That's through the skin, like a gel or a patch, or vaginal or scrotal. There's some skin irritation. 45% of people do not absorb it. I think people don't realize that. I see that all the time. And we'll monitor their blood level, and they'll be taking it every day, and then nothing really goes up. It has to be administered daily or twice a day. And there's a possibility of transferring to others. And if you have children in the house, that might be something that you're worried about, because it does have to dry completely before you touch anybody else or you put your clothing on. And then there's pellets, which is Biote, and it's done every 4 to 5 months. It's a little different with men and women. There's definitely more consistent blood levels over time. We check the blood levels in 6 weeks, but now we're doing it a little bit later. We're checking them 2 weeks before we give the next pellet. And there's mild pain with insertion, and there's a possibility of extrusion, but very minimal. And then patients are restricted to do like very strenuous activity for like maybe 2-3 days afterwards, and that's it.
Many, many patients that come to see me, and I'm sure all of us, are very concerned about, is estrogen safe for me? And a lot of this stems from a study that many of you have probably heard of called the WHI that came out about 20 years ago. And what this found was that in a study of about 27,000 women, average age of 63, there was some questionable increase in risk of breast cancer, among a few other things. However, this study, again, as I mentioned initially, was women of average age of 63. And also in follow-up studies, and when all of that data was reevaluated, it was found that that risk really wasn't there and wasn't significant. In the meanwhile, as someone who was a gynecologist at the time, there was a massive decline and rapidly taking women off hormone replacement therapy without any questions asked, without any discussion, that it was just too unsafe. So what we know, as I said, in reevaluating the data and in follow-up studies, we found that those risks aren't there, but it's still taken a long time to convince women, other physicians, and also just in general, this concern about there being a question of risk of breast health with hormone replacement therapy. But I'm here to reassure you that we are not concerned about that. There's very few and far between patients that we might consider not offering estrogen to. And that would be in certain women with a history of breast cancer in themselves, or in a patient with very, very strong multiple family history relatives affected with breast cancer.
It's really very minimally painful. The patient's lying on their side, and we give a little bit of lidocaine. It's a shot. That's probably the worst, is that little pinch of lidocaine that we give, and a very small incision. And we insert the pellets depending on whether or not there's 2 or 3 pellets. In men, there might be more. And we just place them subcutaneously, and there's just a little steri strip and waterproof dressing that we put. The whole thing takes all of about 3 minutes. Testosterone has been shown to be the bone builder of the hormones, as well as estrogen, but not as much as testosterone. There's a journal that's mentioned here in the American Journal of Obstetrics and Gynecology that shows that there's a 4-fold increase in bone density over oral estrogen and 2.5 times greater over estrogen patches. And they were noted that 8.3% increase in patients that had testosterone sub-Q implants, and 3.5% increase for patches, and 1 to 2% for oral estrogen. So women have a much greater risk than men to develop dementia and Alzheimer's disease, but women on estrogen are 50% less likely to develop Alzheimer's disease, and men with low testosterone are 3 times more likely to develop Alzheimer's disease. Part of that reasoning is there's a pituitary hormone called FSH, and which rises in perimenopause, and that has shown to increase the risk of Alzheimer's. Also, when there's decreased oestrogen in postmenopausal women, that's also plays a role in making them less more prone to learning and memory deficits in women that are postmenopausal. So that's, giving some hormones is really helpful in preventing it, and making women and men feel a lot more, I guess, efficient in what they do and their daily tasks.
Here we're talking about the use of pellets and their effect on the heart. And this again is a positive. So when estrogen replacement was given in the form of subcutaneous pellets, it had positive effects on lipid parameters. It was mentioned before, it can lower low density lipoproteins. People talk about that as so-called bad, the bad ones, and there's good cholesterol and bad. The low density lipoprotein, a reduction will reduce the risk of heart attack. It will also decrease triglyceride levels. When testosterone was added, it is also beneficial. It will not counteract the benefits from the estrogen. So they saw there's 2 parts to this: the actual direct effect on low density lipoproteins, but also a reduction in fat mass was seen in this estrogen plus testosterone group. So this reduction in body fat is critically important in heart health, as you would expect. And the pellets, this reference at the bottom in the American Journal of Obstetrics and Gynecology, was referring specifically to pellets and their effects. And the estrogen and testosterone pellets had beneficial effects on the heart.